It's been 24 hours since insertion of the dentures, and Mr. Poor's had an opportunity to wear them now for a good period of time during that and try them out and see what happens. So the first steps in adjustment of complete dentures is, first of all, talk to the patient, make mental notes or written notes if you wish on what the patient has to tell you about their dislikes, pain, soreness, anything at all that bothers them, looseness, speech, anything that they might have to say about them. And once you do that, you would want to go to the mouth and see if you can find a correlation between their complaints and what you see in the mouth and what might be a cause and effect for those complaints. Not only do you want to look at the chief complaints that a patient has and all of the complaints that the patient may have about the dentures, but you also want to look at all the tissues when you go to the mouth. Don't stop with just, they say it's hurting on the lower right. Don't just look at the lower right and forget it. Look at everything, because very often what you're going to find is if the patient has one major problem, that their focus, their attention will be focused to that one major problem. They may have 4 or 5 other minor problems that you can help them with, that they're really unaware that those problems exist, mainly because the major problem is one that their attention is called to. You have much soreness, Mr. Poor?
Just 2 spots.
Uh-huh. And where are they now?
Both of them are on the lower right.
Lower right, on the inside or the outside?
One's on top, and the other one's on the outside.
On top of the ridge on one side, on the right side, lower right side, and on the outside of the lower right ridge. Okay. All right. What about your speech and eating? What's happened with you? Like I described to you? Slow?
Yeah, slow.
Okay.
Eating, I have no problem.
No problem. Oh, okay. As long as you just take it easy with them and try to solve things like we talked about, right?
Took time.
Yeah. Okay. Now, as you begin to gain confidence in them, then you can start increasing that. Okay. And that's something that's sort of up to you. Is that when you begin to gain confidence in what you're doing with them and everything feels good to you, then you can start increasing what you eat, the size of the bite, and the consistency of it up to what might be normal for you. Okay. So let's have your dentures out of the mouth, Mr. Poor. Nice suction on that upper. I like that. Okay, now, as I said before, I'm not only going to look at the lower right side, I'm going to look at everything that's in there. And I usually routinely do that the first thing. I start with routinely looking in the patient's mouth and see if I see anything. I do it in a routine manner. Anything that looks like it might be a problem to us. Is that sore right there? No, that's an old denture sore, okay? What about right there? Is that sore?
No.
That's from the old denture also. There's a few little spots there. All right, everything looks pretty good on the maxillary. So let's look in the lower now. And on the lower, again, routine manner of looking at things, and I see nothing at all on the left side that, except till I get right there, is a little whitish spot. Does that bother you? Is that sore?
No.
No? Okay. Nothing wrong along the labial. Now we get to the right side, and we see on top of the ridge, lower your chin a little bit. There we go. Can we see that little red line right on top of the ridge right there? And I would assume that's what's been bothering me. Is that correct, Mr. Poor?
Okay.
Right there. Okay. And we look on the outside. Don't see anything really unusual, so that one doesn't correlate, but that's okay. And we're looking at the inside of it. One of the most common areas to find something is right in about the premolar area, but these look pretty good. Those sore at all there or there? Okay, they look pretty good. The only one I really see is right on top of the ridge. Now, did that show up on the film? Okay, let's see if we can use a mirror to... Now, just relax, Mr. Poor. A little red spot now, right on top of the ridge, right there. Can you see that in the mirror?
Yes.
Okay? Just tiny little red spot right on top of the ridge. Now what we do when we find a spot like that is we want to determine two things. First, we want to determine whether or not that spot is caused by occlusion, or is that spot caused by an imperfection in our impression procedure. And there's a fairly simple way of doing that, and that is to take pressure indicator paste, just as we did on insertion day, and with an acid brush and a little pressure indicator paste on the brush, apply the pressure indicator paste, sort of long stroke motions with it so that we have that distribution of it. You can see the brush pattern, and a thin coat of the pressure indicator paste on the base in the areas where we suspect some problem. Now, once you have some pressure indicator paste on it, there's two things that you can do to determine whether or not it's occlusion or whether or not it's an imperfection in the impression. First of all, do not have the opposing denture in the mouth for your first trial of it. As you insert the denture without the influence of the opposing denture, and just put even pressure on it and hold it for a few seconds. And once we've done that, let's take the denture out of the mouth and see if we find on the impression, or on the denture now, a correlation between the two. And we do. As you can see, there's some pressure along the ridge, right along in here, and that's where we saw the pressure intraorally. So I want to relieve this just slightly, right along in this area. I see nothing for his cause of complaint on the outside of it, except maybe a little roughness right there, and right there, and maybe a little bit in the masseter notch area, right in this area. It looks a little funny right in here. So I'm going to reduce this a little bit right there, get rid of this roughness there, and relieve it from the crest of the ridge right in there. Now, relieving it from the crest of the ridge, you would want to use as small an instrument as you have, because that area is small. And so we'll use the smaller one of the E-cutters that we have in the kit. And I find in using Novas, the higher speed that you can get your instrument, the better it cuts. So you want to rev that thing up and get it as high as you can as far as speed is concerned. Cutting Novus or any other resilient type of denture-based material is not as easy as it is to cut a hard material. It's like trying to trim on a sponge. And that usually is a little more difficult to do than on a hard surface. And we still have a little roughness right here, and we want to work on that masseter notch area. And for that, I'm going to switch to the larger burr of the E-cutters. We're just going to smooth this a little bit right here. And right there. And then back in the masseter notch area, I'm going to reduce just a little bit of length in that area, because the suspicion of what we see with that is that we're getting some interference in the masseter notch area. Now that we have those areas trimmed, we're going to clean the pressure indicator paste from the denture base. Apply the pressure indicator paste Sort of long stroke motions with it so that we have that distribution of it. You can see the brush pattern and a thin coat of the pressure indicator paste on the base in the areas where we suspect some problem. Insert the denture without the influence of the opposing denture and just put even pressure on it and hold it for a few seconds. And once we've done that, let's take the denture out of the mouth and see if we find on the impression, or on the denture now, a correlation between the two. Get rid of this roughness there, and relieve it from the crest of the ridge right in there. So you want to rev that thing up and get it as high as you can as far as speed is concerned. Once we have all of the pressure indicator paste removed from it, rinse it. Now we're going to take it back to the mouth again now and insert both dentures. Now I want you to close against them now, Mr. Poor. Very good. Slide them around and around. Very good. Did that help any at all with what you were feeling?
Better.
Feels better to you there now? I think what we had was a very, very slight pressure spot caused from the impression of this particular, in this particular instance, and only really one identifiable sore spot that we could see, and that was on the crest of the ridge. Again, make sure when you have a sore spot like that that you identify whether or not that's caused from pressure within the impression or whether or not it's caused from occlusion. Now I started before to show you how you could tell the difference between the two, and basically what you do is paint it with pressure indicator paste and you seat it in the patient's mouth, and if you find a cause and effect without the influence of the opposing denture, then you grind on the denture base. If you don't find a cause and effect for the pressure area that you find or the soreness that you find with just finger pressure, then place the denture back in the mouth again, and this time put the opposing denture into the mouth and have the patient chew on it for a few seconds. Then remove the denture with the that has the soreness causing the soreness, and look and see if as you have them chew on it, if that soreness begins to show up as a pressure area on the inside of the denture. And if that only occurs, that only shows up on the inside of the denture as a pressure spot when the patient is chewing, then we must assume that the pressure is being caused by occlusion, and we would need to recheck the occlusion again and perhaps do some more selective grinding on the teeth in order to get a more even occlusion. At this point, I think we've done all that we can do for Mr. Poor for today. What we need to do now is to allow him to wear the dentures for a few more days and see what develops. If further soreness develops, then we will need to take care of that in the manner that we did today. If no soreness develops, I usually like to see him in a few days and just see what happens. The timing between this first appointment and the second adjustment appointment depends on how much soreness you see. If you see a lot of soreness in the patient's mouth, you may want to see him again in 24 more hours. If you see very little soreness, you may want to let him to go as much as 5 days to a week before you see him again. So it just depends on what you see. My judgment with Mr. Poor is that we don't need to see him for about 5 more days. That's strictly a judgment call. And so what I would like to do is have Mr. Poor see us in about 5 days, and we will check on him again and see what happens. Well-made dentures generally require 3 to 5 appointments in order to get them well adjusted and the patient perfectly comfortable without any signs of soreness.